following is a production of West Virginia Public Broadcasting.
Major funding for Doctors on Call is provided by a grant from the Milan Charitable Foundation. Other funding is provided by the Health Plan, a health maintenance organization serving West Virginia and Ohio since 1979. By the Center for Organ Recovery and Education, supporting Volunteers for Life through organ, tissue, and corneal donation. By Health South Rehabilitation Hospital, serving your rehabilitation needs in Morgantown and Fairmont. And by the faculty and staff of the Robert C. Byrd Health Sciences Center of West Virginia University. Welcome to Doctors on Call. Tonight's topic, medications. Two experts are here to answer your questions. Now here's your host, Dr. Joe Prudhomme.
Good evening. It seems that you can't watch television or read a magazine these days without seeing an ad for a prescription drug or an over-the-counter medication. From the little blue pill Viagra to aspirin, it can be confusing to determine which drug is right for your condition. This is American Pharmacist Month, and the theme is Know Your Medicine and Know Your Pharmacist. What are the side effects and the possible interactions of the drugs that you're taking? How do you find the medicine that's right for you? Should you be concerned about over-the-counter medicines, vitamins, or supplements? We'll get the answers to those questions and more tonight from our two guests, Dr. Charles Ponte, a clinical pharmacist with the WVU School of Pharmacy and the WVU Department of Family Medicine, and Dr. Betsy Elswick, a clinical pharmacist in the WVU School of Pharmacy whose special interests include providing care in rural areas. If you'd like to ask a question, give us a call. Our phone lines are open now. Charlie, one of the biggest issues in West Virginia is obviously prescription drugs. Abuse, overuse, and now we seem to have the problem of people being scared to take the medicines for fear of getting hooked. Can you talk a little bit about that?
Yeah, I'd be happy to. I think there is a fear on the part of the public that if they take a strong pain medicine, they're going to get addicted to it. From the standpoint that, they're going to be sort of looked upon as someone who you find in a gutter who's trying to seek drugs to get high and to get off and that sort of thing. And I think what the public really needs to know is that an individual who really has some painful condition who gets prescribed a strong pain medication, those sorts of folks very rarely become dependent upon the medication, and they don't really get addicted to it. And I think the word addiction is probably the wrong term to use. I think probably the issue is dependency. I think what people tend to fear most is called psychologic dependency, and that's where they tend to seek the drug for reasons that are beyond pain relief. So it's a very rare occurrence. Probably less than 1 in 100 patients who receives a strong pain medication will probably become psychologically dependent, or again, using that term addicted that most people are probably familiar with. So it's a rare occurrence. And if you really hurt and you have a painful condition and you get prescribed a strong, pain medication, my advice, and I think anybody, another pharmacist or certainly that person's physician will recommend they take it, because the chances of becoming dependent are very, very small.
Okay. I'm sure that you see this in your practice too. One of the things that I have noticed, like Charlie was talking about, is people don't seem to get hooked on the medicine and get in trouble if they're taking it for something they need. The problem seems to be the folks who get the medicine and divert it or sell it to somebody else. That's a big problem in West Virginia, isn't it?
Yes, it is, especially in, I think, the southern part of our state, but that's not to say that north central West Virginia, where we live too, I typically practice in rural areas, and a lot of times we see patients that are prescribed pain medicines for very good reasons, but maybe they have children or grandchildren or even spouses that are sneaking into the medicine cabinet and taking the medicines and then unfortunately selling them on the street. So, it's important for, I think for patients to know, in general, I think addiction is something to be concerned about, but for people that need them and are taking them for the right reason, that they're good to take. Important to use child-proof caps, keep them up away from people, and then if you have any questions about them, to talk to your doctor or to your pharmacist. But diversion is something, unfortunately, in this state that we know all too well. Yep.
I certainly see it a lot. We've got a caller on the line. Our first call tonight is from Jeanette in Lewis County. Jeanette, ask us your question, please.
My name is Jeanette Blyer, and I'm asking, can you get black cohosh on prescription? Because it's natural estrogen, and it also stops my hot flashes.
Black cohosh. Yeah. Black cohosh in this country is sold over the counter, but where are you from originally?
I'm from Great Britain.
Great Britain. So a lot of the herbal products and vitamins are a little bit different in terms of their regulation overseas. So it may be in your country that you saw that as a prescription item. It may have been at a different strength. In this country, black cohosh, which is frequently used for hot flashes, studies sometimes say it's good, other ones say it's not, but they're regulated a little bit differently in this country. And so that one is actually available only non-prescription.
Thank you for the question. That's a good question. You know, one thing that I've heard that does give you some sense that you're getting what you're paying for is the pharma seal. If the non-prescription medicines have the pharma label on them, that means that they voluntarily submitted them for testing as if it were a patent drug.
USP. There's a little embossed little sticker thing that's actually on the bottle, on the label from the USP that sort of meets the standards as far as purity. And now there's an issue that goes really beyond that USP issue, and that is because these are not drugs and not really regulated as such. First of all, there can be no claims made by the manufacturer of that product that it can really treat any illness or disease. Secondly, for products that, let's say, don't carry the USP sort of stamp of approval, one has to be concerned about whether or not there's really a sufficient amount of active ingredient listed actually or in the product. So you really don't know what you're getting with a lot of the products. There is some assurance with the USP designation, but in general, most of the products don't have a USP designation, and so you're really not sure what you're getting. You may be getting, maybe very little of an active drug, quote unquote, maybe getting the right amount, or maybe in some cases an excess amount. So it's kind of very difficult to predict what kind of an effect you're going to have by taking it. And the other thing that I think the listeners need to know about, and the viewers certainly, is that even though they're not considered drugs as such, they can still have effects in the body like a drug. They can interact with other medications that the person may be taking. And so they can really become problems and can lead to perhaps a bad outcome from someone's therapy. They take this product, they think it's safe, they think it's effective. There's no regulation on it. You don't know what the active ingredient is as to how much is in there, and it can have a potential effect on their therapy, and it literally can cause harm. So I think one has to be very careful about any of those sorts of herbal preparations that you can find in a variety of establishments.
And to let their doctor know all of not just the non-prescription kind of Tylenols, aspirins that they're taking, but also the herbal supplements like black cohosh, ginseng, garlic, fish oil that may affect some of their other medicines or surgeries they're getting ready to have.
I'll second that as a surgeon. Thanks for that question. We have another caller on the line, Teresa from Lincoln County. Teresa, please ask us your question.
Yes, I have a roommate, and I'm trying to talk him into going for treatment, like for schizophrenia. And his big problem is he's worried about side effects of possible medications. And, that's his whole point. He's worried about the side effects and what the possible side effects might be for the most commonly prescribed medications.
Teresa, has he already been diagnosed with schizophrenia, or this is just what you're presuming he has?
He was diagnosed about 15, 20 years ago, and he's deathly afraid of medication and doctors.
Okay.
Yeah, Teresa, could I ask you a question? Has he ever been on medication before, and then because maybe of a bad experience that he had with it, it sort of carries over to now his impression that anything I take is going to have a bad side effect, and maybe that could be partly what's kind of going through his mind when he's contemplating or thinking about maybe going to see a physician, a psychiatrist, and then possibly getting some medication. Is that sort of happening with him, do you think?
Yes, that's exactly it, because you see, he was forcibly confined and forcibly given medication.
One of the big pieces of advice, first of all, kudos to her for providing a support network for her roommate and friend, because I think with psychiatric illness or any chronic illness, it's important. And studies have shown that having a supportive network around you increases adherence to medications. So that's really, really important. Adherence is how well you take the medicine or even starting taking the medicine. One of the things I would tell him, first of all, would be, to try to find a doctor that he's comfortable with, a pharmacist as well, and to know that some of the newer medications for schizophrenia have less side effects than some of the older medications, and that those are issues that he can discuss with his psychiatrist or his family physician, his pharmacist, to find the right drug that matches his symptoms, that has maybe fewer side effects, and then to continue getting support from friends like his roommate. I think that would be important.
That's really good advice. And Teresa, good luck to you.
Absolutely.
I will second that about the newer medications having a lot less side effects and encourage him in that. Maybe that will help you. Our next call is from Shirley in Taylor County. Shirley, what's your question for us tonight?
Okay, I use these foot pads for body cleansing, and they're made from real wood and bamboo vinegar. Are they safe to use?
Well, this may be stump the pharmacist because I've frankly not heard of that particular product. Now, if I had a guess, I would say that probably that kind of a product is going to not be subjected to a lot of study, or there may be very little evidence to support its ability to help. Now, let me ask the question: why are you actually using it? What sort of miracle does it seem to?
I think she's already gone, so I don't think we still have her to ask her a follow-up on that. Right. But as long as she's using it externally, it certainly should be safer than something that would take internally. And if it's not giving her any obvious side effects, we hope it's okay. Do you know anything about that product?
I would just be careful of any product that wasn't being used for its intended use. So foot pads may be too abrasive to use if she especially maybe has diabetes or sensitive skin where you worry about just an abrasion turning into an infection. I would probably not recommend it until I knew more about it.
Another issue that sort of goes along with what Betsy is saying is that a lot of older folks tend to get very they get taken in by a lot of the advertising, and some of the advertising are actually geared towards an older person. And so one of the things, other than the fact that it could have potential harm, these people are also putting out money for these products, and in some cases a lot of money when you don't have any evidence that they even work. And so, akin to some kind of a scheme to get money out of an older person. I mean, the same kind of a technique could be used by those that are somewhat seedy to claim benefit with the product. The person then spends $100 to have it mailed to them, and it's just a piece of wood that you tie to your foot, and it really doesn't do much. Except now you have a piece of wood on your foot, and maybe this person now falls because of that. They lose their balance. So it sounds benign, or it doesn't sound like it has a potential for harm, but it really could. And I think people need to be aware of some of these bogus claims as to products that supposedly treat medical conditions that don't.
Well, Shirley, I'm sorry we don't know that particular product, and good luck with it. But you might look and see if you can find some better evidence on that before you hang your hat on it. James from Monongalia County is our next caller. James, what would you like to ask tonight?
Yes, sir. Thanks for taking my call. I had a question I wanted to ask the panel. What's your thought on the medication methadone, and I know how safe is it compared to, say, other pain medication, Oxycontin or Vicodin, that type of medication? I was just curious on that.
Yeah, sure.
How would they? What would that? Excuse me.
I'm sorry. No, I'd be more than happy to try to address that for you. All of the medicines that you referred to are all sort of strong analgesics. They all kind of belong to a sort of a class we call opioids. Now, the thing about methadone, it's a little different than some of the other medications because in terms of how it works in the body and how long it lasts and its potential to go into certain body tissues, and then it sort of comes out of the tissue and you get a more sort of a prolonged effect from it, which can actually get a patient into trouble if it's not dosed properly. So methadone, beyond its use in methadone clinics for people that have dependency issues, but now for pain management, really should be managed by someone who really knows what they're doing with the medication, a physician, a pain expert, who knows how to dose it, how to monitor the patient appropriately, because it has sort of a little different kind of twist on it compared to some of the other strong analgesics. And not only that, but also has effects on the heart. There are certain people that are predisposed to irregular heartbeats with the drug, and so one has to be very cautious and make sure that this is the kind of person who may not have that kind of condition to begin with prior to actually starting that medication, because it can, in a very small number of patients, actually lead to a person's death from a what we call a fatal arrhythmia or a fatal, irregular heartbeat. So you really have to be careful with the drug. It is sort of playing with fire in the wrong hands, and so I urge, utmost caution on the part of either a provider, a clinician, physician, or the patient for that matter. It really needs to be very carefully dosed and carefully monitored.
So I think, to summarize what you're saying, I've understood, is that methadone is not necessarily a safe alternative to the other things you was mentioned. It needs to be used very cautiously,
Yes,
just as all of them.
That's correct, yes.
Perfect. Thanks for that question, James. Next we have Sylvia from Bedford County, Pennsylvania. Sylvia, please ask us your question.
Good evening. My question is, how safe is Forte, F-O-R-T-E, for bone density?
Forte for bone
I
density.
am 81 years old, in good health, except for bone density.
Okay. Betsy, anything else you want to ask Sylvia, background-wise?
Yeah, how long have you been taking the medication?
I have not ever been on Forte.
Oh,
they
you
want
haven't.
me to go on it after being on Actonel for about 8 to 10 years.
Okay.
Doing very well on it, but my bone density is very bad.
So maybe your doctor's wanting to make a change then to try, at your age, being young and 81, it sounds like, to maybe make a change to see if there might be a better drug out there to help treat your osteoporosis. And I think that, there are other medications to treat osteoporosis. Monitoring with any of those different drugs that are out there are going to be important. Getting full body scans to monitor it. Continuing even at 81 to do things like walking a little bit if she can, trying to still get calcium, vitamin D. I think all of those things can go along with it, but working closely with her doctor to find the right drug. And I don't know enough about her history to really say whether that's the best one for her or not, but obviously maybe because there's been a change, the doctor may be thinking there's something else out there.
So Forte is, what's the generic name for Forte? What is Forte?
I don't honestly remember. I don't know, frankly. Yeah, if I knew the generic, then I will say this, though, with respect to what Betsy had said to the caller, one of the things that's so important, especially now this time of year, is the fact that one has to have sufficient amount of vitamin D and calcium, because a lot of these medications that work by kind of maintaining or preventing the bone from sort of the minerals from coming out of the bone, it's very important to maintain calcium and vitamin D intake, especially now that the winter is coming and people will not be outside as much, and even older folks tend not to be outside as much as younger, and they're not really exposed to sunlight. And so it's very important that they have adequate amounts of vitamin D supplementation along with adequate calcium intake as well.
Before we leave Sylvia, I'd like to make one other point, though. Sylvia, and that is that osteoporosis is a very dangerous disease, and that the fractures from osteoporosis are sometimes deadly. Mm-hmm. And so it needs to be treated with something, and your doctor is obviously making what he thinks is the best choice for you. If you have any doubts about it, get a second opinion, but please do treat it if you have bad osteoporosis, and don't choose to do nothing. I think that would be more dangerous than either of the medicines that you mentioned. The next call is from Walter in Harrison County. Walter, what's your question for us tonight?
Good evening. Thank you. I am perturbed about the pharmaceutical companies in making their preparations, why they're selling us amounts far greater than what we need. For example, if I take a vitamin B12 tablet, which is at 100 micrograms, it says that it supplies 1,667%. That's 16 2/3 of the amount of your daily needs. Take the selenium 200 micrograms will supply you with 286% of your daily value. The vitamin D I take is 2,000 international units, and that supplies you. That is one tablet will give you 500% or 5 times more than what you need. Niacin tablets, 100 milligrams, and that will supply you with 5 times or 500% of your daily values.
So far greater than their daily allowances.
And then I do take the multivitamin, multimineral tablet every day. Of course, in its listing, it shows that it contains enough vitamin D supplying 100% of your daily needs. I'm wondering if it was results of my taking too much of these various medications. And I do take the vitamin D that's 2,000 international units and supplies you the 500%. I do cut it up in 4 pieces, so I'm getting 1.25%.
I think we get where you're going is that a lot of these are super therapeutic or higher than the RDA, and you're asking why, and is it dangerous to take more? Is that correct? I think okay. So Walter's question is it dangerous to take greater than the RDA on some of these drugs? And it would depend on which vitamin you're talking about, right?
That's
The
right.
water-soluble one's not so dangerous, but the fat-soluble vitamins you can OD on. You can take too much.
That's right.
And I don't think we want to give a whole long answer to that because each vitamin's different. But
Right.
it is possible to take too much of some of them.
It is possible, and the ones that we tend to worry about are A, D, E, and K. Those are the ones that you mentioned are fat-soluble. And in some cases, yes, if you take too much, that can sort of accumulate in the body, and it does have sort of adverse effects. It could cause side effects.
I would talk to his doctor about any of those, make sure, because it sounds like he's taking a whole lot of them, and I'd be interested why he's taking them, you know, for each single one of them, and then combined, are they interacting? Are they causing any side? Does he need to be taking all of those? Because he really might not need to be taking all of them.
And nobody knows for sure about some of that stuff, but the A, D, E, and K that Charlie mentioned is important because those are the ones that are retained by your body that you can really OD on. So focus on those. Our next call is Ruth Ann in Fayette County, Pennsylvania. Ruth Ann, ask us your question, please.
Yes, I am currently taking levothyroxine for hypothyroidism, and I'm also having trouble with night sweats and hot flashes. And I don't want to do a hormone replacement therapy. But I've heard that the different products on the market have soy in them. But I've also heard that soy is not good with the thyroid medication. And I wanted to know if you know anything about that.
Ruth Ann, how old are you, and how long have you been? How long ago did you start going through menopause?
Actually, I just found out in September that I am now postmenopause.
Okay, and how many years young are you?
47.
47. Okay. Do you want to take that one?
Oh, gosh. You know, soy, it kind of becomes popular and then it doesn't. We see it kind of trend in and out. And I think as well, we had a caller earlier about black cohosh. And, you know, even with studies out this week, and we were talking a little bit about estrogen and replacements and maybe some health risks and all of these different things that women obviously are concerned about because they want to treat the symptoms associated with menopause, but, you know, they're concerned about side effects and whatnot. You know, soy, in terms of really good studies about soy, I haven't really read anything to say yay or nay, but soy in itself, you know, soy products are generally very healthful. They're also very tasty. I know soybeans, edamame, all of those products are really, really good for you. They have a lot of good vitamins and stuff. So if she finds relief from soy products, I don't necessarily have a problem with that. The question she had about soy interacting with thyroid medicine is a really interesting one because I have to be honest and say, you know, there are 2 types of questions. There's a good question and a really good question. That's a really good question because I don't know the answer to it. But I would encourage her to speak to her doctor and pharmacist.
Yeah, that's a great question for your pharmacist, by the way.
Absolutely.
Ruth Ann. When
Make them look it up.
Thyroid medicine next time, ask the pharmacist.
Yeah.
I'm taking this kind of soy. Is there an interaction?
And
that's
they have
the
really
ideal way to figure it out.
Really in-depth drug information resources that unfortunately we don't have our fingers on this show, but they can go in with some herbal resources and find out, is that an interaction or not?
Right. Let's see if we can get one more question. We've got Jim from Mercer County on the line. Jim, we've got about a minute left. Can you ask us your question? Maybe we can get you an answer?
Okay, thank you. My doctor put me on Lumigan for glaucoma, and because my insurance stopped paying for it, he changed it to Zalatan. Xalatan, and I was wondering, like, my copay for that is 31%, and I know that's not going to be cheap. Is there another medication out there where I can possibly that might cost less? That you know, maybe not as new, but still does the
That's probably
job?
a question that we need to take more time with, and I know that we're short. I would definitely refer him back to his pharmacist for that, because really ultimately the pharmacist can work with him to find out maybe what drugs are covered on the formulary, figuring out what plan he has, and then
that's
really
the key,
working
is
with the
his
doctor.
particular drug plan.
Absolutely,
So,
working
Jim,
with the doctor.
You have to ask your pharmacist about your plan. That's a great question for him. Thanks for that question.
Absolutely.
We've been talking about medications tonight with pharmacists Dr. Charles Ponte and Dr. Betsy Ellswick. Thank you both for being with us. If you'd like to ask any more information, please talk to your doctor or your pharmacist. Your pharmacists love to talk to you. Or visit our website at wvuhealthcare.com. For Doctors on Call, I'm Dr. Joe Prudhomme. Good night and good health.
Join us again next week for Doctors on Call. Our topic will be cosmetic and plastic surgery. Major funding for Doctors on Call is provided by a grant from the Milan Charitable Foundation. Other funding is provided by the Health Plan, a health maintenance organization serving West Virginia and Ohio since 1979. By the Center for Organ Recovery and Education, supporting Volunteers for Life through organ, tissue, and corneal donation. By Health South Rehabilitation Hospital, serving your rehabilitation needs in Morgantown and Fairmont. And by the faculty and staff of the Robert C. Byrd Health Sciences Center of West Virginia University.
This has been a production of West Virginia Public Broadcasting.